A couple of weeks ago, we talked on the line about why more voices weren't joining the chorus to warn about COVID spread. That chorus is loud now. Early this week, doctors from UNM, Presbyterian, and Loveless sounded the alarm about unsustainable caseloads that have, as predicted, found their way into hospital beds. Now, some 300 people are in the hospital currently with COVID-19. And Trip, we've been able to beat back the virus twice before. Something feels a little bit different, though, this time around, doesn't it?
It does. I mean, when I started to see some of the numbers, New Mexico shattered the single day case record a couple of weeks ago. It was up over 800, and I think they had 800 recently this week as well. What I thought about was that people in March, in April, maybe even earlier, were saying the fall and winter are going to be really bad for COVID. You can't let your guard down. This is partly historical. I mean, I think about the 1918 pandemic. The second wave is what really was devastating, not the first wave.
Right.
I'm not saying that's going to happen here, but for a long time, I was waiting for that second phase, and I think we're in it now. I know that watching the El Paso numbers, it's stunning because we're so close. Las Cruces and Chaparral are close, and they're up over 1,000. They were a couple of days. And that's happening everywhere. So I think it's also been hard for folks because we're now 7.5 months in and people are tired. But we've got several months to go, I think.
Well, there's a curfew in El Paso now, too. I mean, that just goes to show you, Christine, you know El Paso well, that's for sure. And, when you see the numbers here for New Mexico doing what they're doing, is it more worrisome for people hearing doctors talk about this, or is it more effective to hear it from doctors versus... I mean, Dr. Scrace is obviously a doctor, but you know what I'm saying, as opposed to an elected official?
Well, Gene, unfortunately, we seem to be in quite a dilemma, quite an awful situation where people have taken sides on how to respond to the virus. And one would think that doctors messaging a very clear and consistent message of how to engage in responsibility and behavior and so on would take hold. But look at the National Task Force. Look at Dr. Fauci and how this current president is demeaning him and dismissing him and his expertise. So my point that I'd like to make is how unfortunate that we have now a chasm, a divide over what I would characterize as people who think that they're advocating for the protection of individual rights versus something that's larger, that's going to take away, threatening them. I would say that that's not really a case of individual rights, that as a country, we have always figured out how to merge individual rights under the umbrella of the public good. And there are a number of ways in which we have looked at governmental rules that tell us how to behave and how to limit our social behavior. That should be, again, what we would try to seek. How can we merge the fact that we show self-responsibility in wearing masks, social distancing, and so on, as a factor in enhancing community health, in improving our ability to fight this virus? But that is a chasm. That is an ideological, or maybe not even ideological, maybe just stubbornness. Some people don't want to be told what to do. Right. And by golly, nobody is going to do that. Doctors, government officials, or whatever. We have got to have communication from the top. And this is where elected officials come in, including the President of the United States, sending a consistent and clear message, one of communication that would lead to cooperation.
Gabe, interesting. I've had this awful feeling that we are at peak mask, meaning all those who are going to be masked are masked, and those, as Christine just mentioned, who are not inclined to go there are just not going to go there no matter who's telling them to do it. So what does that mean for policymakers? If we're going to have a tough winter here, we've got questions about whether students should go home for Thanksgiving break, Christmas break. There's a lot of factors out there. What more can the governor do at this point to kind of get these numbers down at this point?
It's a very difficult situation. Our team at UNM actually has been tracking this extensively in our polling across the country. And just to put some numbers to what we've already started and backing up Christine's point, when we ask folks, are you wearing a mask in public, covering your face to try to reduce the spread of COVID-19? One of the strongest predictors of who's wearing a mask and who isn't is your partisanship. That has more effect than just about anything else we can throw in an empirical model to analyze. And when we ask folks after the fact, hey, you just told us that you wear a mask, what's the number one reason you were doing so? Number one reason people give us is to protect myself and others. So it's a collective, a community-oriented ideology. We ask the folks who aren't wearing masks, what's the number one reason? They say it's my right as an American to choose if I don't want to do it. And so I think it's that underlying ideological difference that's really filtering into people's behavior. So the governor faces a difficult reality here. You're seeing early on, I think, so much pride for those of us in New Mexico for how well our state was performing. But as time goes on, right, the conversation starts to shift about, hey, we need to be thinking about the economic side of this issue. We need to open up business to save small business, et cetera. And that puts the governor in a very difficult position because there's not much more she can do with her authority to push from that issue. And I would think, looking forward, unfortunately, our data suggests we're going to have the same conversation when it comes around to a vaccine, with a sizable segment of the American and New Mexican population who are going to say, just like it's my right not to wear a mask, are going to say it's my right not to take this vaccine. So unfortunately, we're not going to be out of the woods on this, even when a vaccine is available. And I think it's going to be the same underlying difference we're seeing in the context of wearing a mask. And I'll point out, finally, in our data, we find that even men of color who will tell us in the survey, I know this potentially puts me in harm's way with police and security to be wearing a mask in public, I'm still doing it because I recognize the severity of COVID-19. I think that says an awful lot about where we are as a country right now.
Oof, man, it sure does. That's amazing. Trip, we had hundreds gather at the Roundhouse recently to protest the governor's approach to this. Not a one of them. I shouldn't say not a one of them. There were a few masks, but certainly not the majority. I have to ask the same question. What more can any government person do? Taking it off of Governor Lujan Grisham here and just, system-wide, any mayor, can anyone really push this thing forward in your view? Or we just have to get it out?
I honestly don't know how to respond to that question. I don't know what, really it's about, how far one wants to go with like police powers or something. Who knows? And I'm not sure that the governor wants to go there. Mm-hmm. I saw the stories about the rally, and I just want to say, kind of piggyback on what Gabe was saying, it's kind of extraordinary when I talk to folks about, wearing masks and why, and it is this kind of community versus individual thing. And I saw that, and I was thinking, as I read the stories, it was like these individuals go back to families and friends and stuff like this. And it is sort of like a super spreader event. We don't know if that particular thing has happened because outside tends to be better than inside, as far as the passing the virus around. But I don't know what a governor can do. Now, I'll say this. I think there's a possibility that we may go into another lockdown or shutdown here in the future.
That's what I was going to bring up, and Gabe, let me swing back to you on that. I'm sorry, Christine. Sorry, I wanted to start with you on that one. How much do we have the taste for that? Is that palatable? If the governor came out and said, "Look, guys, it's going to be 10 o'clock like El Paso's doing, et cetera," how how does that even work at that point?
I think we need some teaching moments here. And one of the things I was heartened by was the Restaurant Association agreeing with the governor in the spirit of compromise and trying to figure out how they could work with her and the two sides could come up with some short-term solutions that seemed to satisfy both. The other thing is, I think, posting the watch list by the New Mexico Environmental Department, where people then can take it on their own and look up where places have reported virus infections and so on. That's something that people can do on their own. And does
that seem like a reasonable threshold to you, by the way they've got it set up? If you've got a certain number of cases in 2 weeks, you have to shut down?
That's not my expertise. But I would just say that we've got to get the messaging across that we compromise on individual rights and collective goodness all the time. traffic regulations. We have seatbelts requirements. We have drinking laws. I mean, there's all kinds of things in our social lives that compromise is not an issue. And so I think we've got to break down these walls, if you will, that the president has built. It's not just him, but of course, exacerbates, and tell people, look, like you guys said, these are your families. You are a member of a larger unit, and take responsibility for that.
Hey, Gabe, I want to ask you this. What do you make of the situation that befell State Senator Jacob Candelaria, who was really hassled to the point of leaving his own home because he was critical of those who didn't wear masks? And there's a danger point, it seems to me, where if someone's going to come out and criticize those who don't wear masks, but the response is going to be threats on your life and on your family and on your home, then we're in a bad situation completely, that no one's hearing anything at that point.
Yeah, I think it's unfortunate that we're seeing this happen in New Mexico, but keep in mind, this started months ago in other places in the country, with unfortunately security guards being shot and killed for trying to enforce city ordinances. So it's unfortunate that it's finally happened in New Mexico, but this tension, and I've been writing about this in my academic research for Brookings, for Washington Post and others for months, that this tension point was wearing of masks. And for whatever reason, that has been the tip of the spear in terms of jurisdictions trying to impose curfews and other policies to reduce the spread, and a wide segment of the population that is just pushing back extensively on this because they don't want to have their individual rights violated. And I'll say, if you look at the data on the tracing in New Mexico, a couple of things stick out. It looks like the spreads are due primarily to drinking at a brewery or a restaurant, going out on a social activity, traveling out of state, or increasingly small parties within individuals' homes. And so if you look at the data, you say, well, how do we target that? Limit people from traveling out of state, do closures like we're talking about, and all these things in terms of the restaurants. But the toughest thing is, as we come around the holidays, and you've got Thanksgiving, and you've got Christmas around the corner, how do you prevent individuals from having get-togethers of their family? Such a big cultural dynamic for so many New Mexicans. That's right. What worries me the most, that if I'm a policymaker, how do you exactly tackle it?
That's a good point. Thank you all three for your thoughts this week. We look forward to hopefully seeing you, some of you, on election night as we gather virtually. You can find that conversation on our New Mexico in Focus Facebook page. Before we go, we want to share some of the press briefing that doctors from UNM, Presbyterian, and Loveless held earlier this week, especially the thoughts they shared on staffing levels, hospital capacity, and how New Mexicans should react to the latest numbers.